New Zealand's healthcare system is laughable. We supposedly have free healthcare, yet you can expect to pay $60 if you want to spend 5 minutes speaking to a doctor. And that is with a substantial subsidy. Subsidies are not good enough. Doctor appointments should be fully funded. Such a policy would encourage people to pursue medical assistance when they require it. This would allow for serious issues to be identified and addressed early in their development, reducing the burden on the health system that they could come to cause. High costs discourage people from visiting a doctor. Soon a minor ailment that could have been treated with ease becomes a serious issue. A person finds themselves in hospital. This causes needless suffering, is more expensive for the taxpayer, and undermines economic productivity by putting people out of work. Free doctor appointments are crucial. They encourage people to visit the doctor. They allow for issues to be identified and addressed early in their development before they become a major burden on the system and the society. This policy is not particularly expensive when you consider the savings that accumulate from preventing medical issues developing and becoming more serious and more expensive to address. This policy would improve health among the impoverished and the marginalised by making it easier for them to seek healthcare assistance. This policy would address lower life expectancy among the impoverished and the marginalised by making it easier to address medical issues as early as possible. Expensive appointment costs discourage people from visiting the doctor. This allows for health issues to go unidentified and unaddressed until they inevitably become serious issues and burden the health system with far greater costs and lower economic productivity as workers are put out of action. Fully funded doctor appointments are a necessity. This is a common sense and pragmatic social welfare reform. The obvious question is, how do you fund it? A capital gains tax or a land tax could fund such a policy. Both of these tax measures have been recommended by the IMF. They are far from radical. They are common sense tax reform. They could easily be used to fund investment in public health. Such investment will create desirable results both socially and economically. Such investment can prevent the long-term burden on the healthcare system and ensure that people are economically productive.